Everyone, Michelle Kondo. I'm a research social scientist. I work for the U.S. Forest Service, and I'm stationed in Philadelphia, so not too far away. I am part of a research unit that, we're known as the urban unit. And I think a lot of people don't know that the Forest Service has an urban presence where there are a number of urban field stations. So we have them in New York City and Baltimore, Chicago. And so I like to tell people, the primary mission of the Forest Service is to manage our national forests, which there are about 190 million acres. But there are also in this country about 170 million acres of urban forests. And there is a entire, group of people, committed people to managing those forests, and they need support. And we, and my research unit, the urban unit, we aim to support those folks that are doing that important work with our research. And so I'm here. I also want to pause a second and tell you, for all of you students out there, how I got here a little bit. I was opening, my mom gave me a box of stuff. Here, this stuff I've had stored for, a long time. And I leafed through it and I found term papers from my undergraduate degree days. I found one study on, how parks at the turn of the 20th century were designed for or not designed for women. I found another term paper on how public housing was designed, to reduce crime and violence, although it may not have had that, it may have had an opposite effect. But I thought, oh my gosh, I've known all along what I wanted to do. So my work is kind of a culmination of that, even though I've had very interdisciplinary, as some people would say, a very confusing and circuitous route. Today, I study the impact of place-based and person-based interventions on human health and safety. So I do focus on violence and violence prevention because I'm stationed in Philadelphia, and it is really the #1 health concern for residents in that city. I do focus on mental health as well. And so person-based, I helped start this program called Prescribe Outside. Physicians at the Children's Hospital of Philadelphia are giving nature prescriptions. And so we engage those patients in weekly activities. We're doing things like we are co-creating with patients that are referred to a violence intervention program, some nature-based outdoor activities that we will then use to measure, what difference can outdoor programming make for these individuals. I've also been involved in some nature-based or place-based intervention studies. Vacant lots are a huge issue in cities like Philadelphia, Baltimore, and other post-industrial places. We have about 40,000 vacant lots, and they are negative impacts on people's health. So I was part of a randomized controlled trial where we tested vacant lot cleaning and greening and found a 30% relative to control lots. We found 30% reduction, a relative reduction in gun violence. I'm engaging as well in other studies that test, well, what difference does community engagement in that vacant lot maintenance make on violence outcomes? Schoolyard grading as well is another intervention I'm studying. So thank you.